Let's talk right now about, well, the COVID inquiry and very closely related, a new report coming out on Thursday looking at the NHS. Its progress is in decline for the first time in 50 years. Are these two subjects by any chance related? Well, let's talk to Carl Heneghan. He's Professor of Evidence-Based Medicine at the University of Oxford and joins us. Good afternoon to you.
Hi, Julia. Good afternoon.
Lovely to talk to you. Let's start with COVID, of course. I do think these things are very closely related. And, of course, we've got the COVID inquiry. This is the third module they're looking at different impacts of different aspects of COVID policy. And this one is all about healthcare. Healthcare at the time, PPE, masks, the policy of trying to stop COVID within hospitals, but also the impact on long-term healthcare as well. What do you expect that we're going to learn from this?
Well, this is the third module of 9, Julia. So, look, and the remit is quite broad, as you said, how hospitals responded, infections in hospitals, do not resuscitate audience, triage tools for denying care. What about the Nightingale hospitals? In fact, one good thing is they're going to even ask the question, was it right to protect the NHS? Was that a good question? But one question I'd ask you, we've been talking about money, and money is spare. We're now talking about 160 million we've spent so far. There are about 280 civil servants working on this, about £190,000 a day. I just think, look, this is going to run right through till December again, this month. Huge expense. Are we going to learn anything? I'm not sure. However, I do think in this next few months, there'll be some real moments that will get me back on, because I think there are going to be people who submit pieces of research, evidence, opinions that we go, really? And I think that's important. Yeah. The second thing I'd say is, I wonder what's starting to happen in the inquiry. If they're starting to realise as they get more and more information, they're starting to question things and going, but you know what, it's a bit more uncertain than all those modellers and advisors said. Actually, there were lots of really difficult and complex things that were going on that didn't seem quite right. A good example of that will be the do not resuscitate orders that were used in March, April, that were wheeled out too fast. And I think we have to have serious questions about those issues. But will we learn anything? I don't know, and it's going to be...
I think Isabel Oakeshott produced the most amount of information with those revelations from Matt Hancock, the then Health Secretary's WhatsApp messages, where we saw what was going on in government and how completely chaotic and just on a whim that most of the decisions were made. And that, I think, is what's most telling. Although, of course, we don't have the WhatsApps from March 2020, when the massive change in opinion on whether we were going to lock down, which we weren't going to do, publicly stated, and then suddenly everything changed, and we still don't have the evidence for all of that. But the big concern about the COVID inquiry from lots of people I know, particularly those of us who campaigned against lockdowns and certainly them continuing the repeated lockdowns and children out of school, mask mandates, all of that, is there seems to be so much focus and emphasis on sort of tittle-tattle and who liked who and who didn't like who, and people point scoring as opposed to getting to the bottom of things. And that was something that you and I and many others who campaigned against a lot of the policies wanted at the time, which was, you know, again, I supported it. I assumed they had evidence for a lockdown. So I thought it was a good idea at the beginning. It didn't occur to me that they didn't have evidence. That was mind-blowing to me. But it is just extraordinary how, you know, how little the COVID inquiry has got to the bottom of the absolute, I mean, just incredibly low level of debate and information exchange that was going on in government and in the NHS at that time and subsequently.
Because it's a judge-led inquiry, it's taking sort of expert opinion. What I think should happen now, Julia, is they should set out a review of the evidence of the collateral damage of lockdowns. Because if anybody's not convinced, as we still sit here with an economy that's in tatters, looking at our children's education, people are talking about the crisis in hospitals. If you set out that evidence clear and says, if you lock down, here's the short, medium, long-term consequences, you would look at it and go, what a disaster of a decision. But at the time, it's like you've got a credit card and you can max it out. You just go and spend, but there'll come a day when you've got to repay that debt. And we are going to be repaying this debt for decades to come. And this inquiry is not prepared to take the evidence and say, let's look at the collateral impact of these restrictions or lockdown. And let's compare them to somewhere like Sweden that didn't do that.
Indeed. And what frustrates me the most is when the amount of times people will say to me on social media, or, you know, people I might chat to in a bar or at a party, and they'll say, yes, but we didn't know then what we know now. actually, if you go back and look at the statements made by Professor Chris Whitty and Sir Patrick Vallance, they were made, if you look back at mid-March, a week or two before we actually locked down, they were saying everything that we know now. We knew it was elderly people that were most impacted. We knew a lot about how it spread. We knew that closing schools wouldn't save lives. We knew that, you know, they knew all of this. They knew that the vast majority of people would not be severely affected, and yet they did it anyway. And I find it extraordinary how many people, the majority of people in this country, still think it was the right thing to do.
Because I think what happened here is they got panicked into the hysteria to flip-flop their arguments. And in doing so, then spent a lot of time defending that status quo position. And this is a real issue that needs to be addressed, because you go, look, if we're going to you have all this £300 million inquiry, but what's going to happen is in an era of 24-hour news, social media, you're just going to panic and flip the switch and lock us down again. What is the point of the inquiry? Yeah. You don't ask the central question, which you're right. It was very clear early on there were lots of mistakes being made because people were telling you, remember this one, 2 weeks to flatten the curve. That's all you need. And you had people like Barack Obama on social media telling you within 2 weeks we'll lock down and everything will be fine. And the exact opposite happened.
Yeah. But also, we knew literally I watched back recently a press conference, on the number 10 press conferences, where genuinely they were saying, no, you see how if you just lock down, it'll just come back. You're doing is delaying it, and then it would just come back again. I mean, they knew that. They knew that, but they did it anyway. Look, this, of course, all leads in. You talked about the collateral damage. Collateral damage, massive impact on NHS waiting lists. The waiting lists were already massive and growing before COVID. So let's not give a free pass to the Conservative government on that over the years. But we've got a big report coming out on Thursday. This is all, I think, all very much linked. And this is a report by Lord Aradaiza. He's a surgeon. He's a former Labour health minister. And this week, this report is going to say the NHS progress is going backwards for the first time in 50 years in terms of people waiting, particularly children in A&E, routine services grinding to a halt during the pandemic and the knock-on effect of that. But also just, the progress on tackling deaths from heart disease and long waits for treatment, basically saying we are going backwards, not forwards, for the first time. What do you make of that as someone who's not just a professor dealing with the theory of this? You work in A&E, most weeks.
So I think first, the rhetoric of 50 years is actually a sideshow, because it's a distractor. I can go back to 1997 when we were spending 37 billion in the NHS. And actually, as he came in then, people were strewn across the corridors, outside in ambulances. There was no social media and 24-hour news. People ignored it unless they were actually people. So there has been times where it's been bad. We've had times where there's been investment and things have been fixed. So in the noughties, we fixed the waiting list. Where we sit now, you're right. It was about over 4 million, the waiting list, and it's ballooned to 7.6 million. But the problem now is we've got this insatiable appetite for healthcare. And with that, we've got the insatiable appetite that we can prevent all illness without doing the basics. Yeah. Eat a little bit less, exercise a little bit more, drink a little bit less, Julia. Yeah. You know the rules. They're
all
a bit,
right. Bit personal.
But anybody, this is my basic rule, anybody who gives you a simple fix to a highly complex problem will be wrong. And watch this week. What's going to happen is, unfortunately, the health secretary is going to come forward and say, here's the solution. Yeah. Actually, what we need to do is stabilise things. The first thing you've got to do is stabilise the waiting list, the emergency care.
Yeah.
I would also have some priorities. I do feel I would have a priority about cancer care. I would like to see a priority that says anybody who has a diagnosis will be seen and treated within 1 week, and that's our priority. Yeah. Some things will have to go on the back burner that are low value, don't provide an evidence-based approach, but here we've got something where we can make a real difference to you. Do you want to support it? Would we pay a little bit more tax for that? I suspect we would do.
I think we absolutely would, Carl. Oh, thank you so much. There's so much more I want to talk to you about. We'd have to leave it there. Time's against us, but come on again soon. I know you will. Carl Heneghan, Professor of Evidence-Based Medicine, University of Oxford. Thank you for that. It's bringing Theo Ushwood, listening to all of that. Look, going back to COVID, you were someone, you mentioned on the show earlier, mentioned it before, you actually, you were hit. I mean, I caught it in March 2020. I was unwell for a month. I was really knocked out by it. Nothing like you. You were in a high dependency ward in hospital for a week, and you were in your 30s, 38, slim, healthy. You didn't tick any of the boxes for people who were supposed to be. So we know that diseases can hit horribly. Does that actually sort of colour your views on this issue and on COVID policy at all?
I think my frustration is that I try and take a balanced view, because whilst I recognise what happened to me, and it was extraordinary what happened to me given my age and how fit and healthy I was, I also recognise the effect it happened because of speaking to family members and friends, the effect of the various policies that were introduced, what happened on them. You know, somebody fairly close to my father lost their life because they were diagnosed, they had pancreatic cancer, and they couldn't get an appointment at their GP to get the diagnosis, and in the end they only ended up living a matter of months, and they could have had potentially a couple of years. But every time they tried to get an appointment to their GP, they were just turned away.
It's too risky to come in because of COVID. No, the pancreatic cancer will get you first.
So you would hope that one of the lessons that would be learned from this is not just speaking to necessarily the victims of those who suffered from COVID, and they absolutely need to be heard in this inquiry, but also the victims of those who lost, who lost loved ones, who didn't get the treatment.
I'm sorry, but genuinely, COVID family members bereaved. I'm really sorry for anyone who's lost a loved one, but we've all lost loved ones. The idea that these people somehow have a greater moral status than everybody else, when you've got someone saying it's absolutely awful that my 98-year-old mother was in a care home and died of COVID and she was killed. I mean, with all due respect, 98-year-olds in care homes do actually have a habit of dying.
But to Carl's point, there was never a conversation about that. There was never an open conversation about how we have that.
No, I'm not saying it doesn't matter. No, exactly. Not saying, oh, we don't care about old people, but we must also care about everyone else. I've got friends who didn't get their mammogram, their routine mammogram, and so their breast cancer was discovered years later. I mean, given a choice between a 98-year-old in a care home and a young woman with breast cancer, I know who I'd choose to prioritise. I'm sorry, I know, and it ain't the 98-year-old.
And we had a situation where number 10 was just taking information from the scientists, and number 10, the central government is like a bicycle wheel. It's like a hub of a bicycle wheel. It needs to take information in from lots of different people, not just from one spoke,
and not being panicked by 24-hour social media. I'm saying we could do this for years. We did do it for years.